Hi everyone, it's Dr. Tucker. I want to touch on how health works today with a nice visual. I had a mentor, another doctor named Dr. Gatempo, who had showed us a little bit about your body's adaptive ability to health. So how do you know if you're sick, really sick, slightly sick, maybe almost sick, or are you really healthy? So there's this broad spectrum that a lot of people just really don't know how to decipher. So, this doc had told me a little bit of kind of the breakdown of steps, and that's what I want to kind of relay to everyone today is, what is that spectrum? What are some of the specific aspects of the spectrum? And how do we interject with that with medicine, with chiropractic? Where do we fall on the spectrum? So, obviously there's two ends of the spectrum. Let's see if I can flip this. Yep. All right, I'll have to turn it with me. And kind of root out a few bullets here. See if I can get it on camera. So what we have initially on one end of the spectrum is basically optimum health. So here's one side of it. Now optimum health is perfect. Everything's functioning well. It's not just being pain-free. So this is where you want to be. Okay? Now, the second aspect is stress. We've got P for physical, C for chemical, E for emotional. Any one of these stressors will start creating a problem. They'll start to have an impact on the nervous system, which starts to create muscle tension, which pulls vertebrae out of alignment, which puts those kinks in our necks, our shoulders, our low back. And this is a condition where that means there's not optimal nerve function. It's a subluxation. So when there's a kink in communication output, that stress caused that nerve to start to have an issue. Well, we start to have a pattern of degenerative changes after that, because pinched nerve, poor health, due to all the stressors, starts to create some sort of pathological change. So the P here is pathology. We've got asymptomatic pathology, which is somebody having a high pulse, fast breathing rate from stress, anything where, they're ultimately not at their best potential. So you start to see something like a cancer cell mutating or forming. Before it's symptomatic, there's this, pre-symptomatic state. So you can have muscle tension, not even know it's there before you have pain. But eventually, if the asymptomatic findings there, right, the pathology is asymptomatic, does not get fixed, eventually it becomes symptomatic pathology. So now that muscle can start to create muscle pathology. That's just slightly tight and asymptomatic. Symptomatic pathology is that slight mutation in the cell was not engulfed, cleaned up, mutated to cancer. So symptomatic pathology is everything we know. Your diabetes. Symptomatic pathology is your heart disease, your cancers, your nerve disorders. I mean, you're basically feeling disease processes. So that's symptomatic. Okay? So we talked about optimal health. We talked about the stress. We talked about how that causes subluxation, irritation, some sort of start of pathology that's not necessarily symptomatic yet. Then eventually, if not fixed, it becomes symptomatic. And if you've got symptoms like heart disease, cancer, diabetes, nervous system disorders, eventually you got the under end of the spectrum, and that's death. So the question now really is, how do we intervene with these? So medical care typically is great at trying to come in and treat the symptomatic pathology. We've got drugs, we've got surgery. So, they'll remove your gallbladder, they'll, cut out part of your colon, they'll, give you cortisone shots for pain. So, they're treating this end of the spectrum. This is what they do. This is what prevents death. This is what we call sickness care, right? So maybe if you get lucky, they'll catch some, asymptomatic pathology. You're looking at things like what? Well, maybe you're looking at things like, you know, a blood pressure screening. Maybe they'll catch something in that regard. So, you know, a good medical doctor will start to catch things, you know, when there's some early signs of asymptomatic pathology. Now, what is a chiropractor's goal? A chiropractor's trying to not treat back pain, but to educate his patient to move on the other end of the spectrum. So preventative habits, proactive habits. So instead of the classic pathology states, sickness care, we're looking at stress on the nervous system, candidly pain or no pain. So a chiropractor should be looking to see if there's tension in the spine and nervous system. X-rays, palpation and how everything feels and moves, nerve scans. So there's some tools you can use to catch this earlier. And then teaching the patient what is the root cause of their problem. What was their initial physical, chemical, or emotional stress that caused it? Because if we can get to the root cause, we can start to manage or avoid it, and that's what gets us to optimal health. So the question is, at what point do you want to interject with care? It depends on your philosophy. If you're symptomatic oriented and you're looking to just treat disease and pathology, well, sickness care is the way to go. But if you're trying to avoid that end of the spectrum and you want to work more on the optimal health end, that's where I think, you know, a good chiropractor can help guide you. So hopefully the spectrum made sense and you guys can start applying it in your lives. Thanks.